Welcome to the Bird Island Wellness Podcast, where we explore the intersection of health, wellness, and community. I'm your host, Julie Kane, nurse practitioner and owner of Bird Island Wellness. Each week, we'll dive into a wide range of topics from nutrition and fitness to mental health and holistic healing. Whether you're looking for practical tips to improve your well-being or seeking inspiration from real stories of transformation, you'll find it here. But Bird Island Wellness isn't just about me sharing my knowledge. It's about bringing together experts, patients, and community members to have meaningful conversations about what it means to live a healthy and fulfilling life. So, join me as we explore the latest research, we debunk myths, and discover innovative approaches to health and wellness. Together, we'll empower each other to make informed choices and create positive change in our lives and communities. So, grab your headphones, take a seat, and let's embark on this journey to optimal health and well-being together. Welcome to the Bird Island Wellness Podcast. With Emma, who is a patient who has been diagnosed with PCOS or Polycystic Ovarian Syndrome. And just to give a brief overview of what that is, thank you, Emma. Welcome. Thank you for volunteering to do this interview.
Hi, everyone.
But let's give just a little bit of a background as to what PCOS is. It is one of the most common hormone disorders that we see in women during their reproductive years. And there's lots of, there's lots of different symptoms women present with, which makes this a very complex disease process to diagnose. And a lot of women go undiagnosed. So the whole purpose of this interview is to kind of help educate and help bring to light, if you're experiencing any of these symptoms, it is very important that you seek a medical provider who hopefully can help. So again, this is for information purposes only. PCOS, women can present with lots of different symptoms, ranging from acne, rapid weight gain in like later puberty. Your symptoms can basically start during puberty, but it can go on. I've seen women in their 40s with, hormonal acne still, which can be a very, a very apparent symptom of PCOS. There's lots of different things that can be done, and it is important to get that diagnosis. So again, thank you, Emma. And I've got quite a list of questions for you. So hopefully it won't be too painful for you, but anyway. So first of all, I'd like for you to share your personal journey with PCOS from when you first suspected something was going on or going wrong and when you received a diagnosis. If you could share that with us.
So I guess the earliest that I could remember having any kind of symptoms related to PCOS would have been around the time that I was maybe 17 years old. I was on my way to boot camp for the Air Force. And at that time, I didn't realize that the initial symptoms that I was having were related to PCOS. I thought that I was just a teenager with really bad acne. And, maybe it was dietary decisions. I'm not really sure. But when I came back from boot camp, this was something that was persisting no matter how clean my diet had been at that time. That was the thing that my doctors had kept telling me was make sure that you're eating a very clean diet. I feel like when I was in boot camp, I had probably the best routine and structure that I had for a very long time. I was regularly exercising. I was eating salads most days because we had a cafeteria that would prepare awesome food for us. And so that was the beginning of it. And then a couple years go by. I'm not in sports as regularly as I had been. So I chalked up some of my weight gain to the fact that maybe I was a little more inactive than I traditionally had been. And then around 2019, I was starting to get really bad abdominal pain periodically. So when I was in Airman Leadership School with the military, I had gotten checked into the ER because I had horrible, horrible abdominal pain, and they had done an ultrasound, and they had seen at that time that I had a ovarian cyst that had ruptured, or that was their suspicion. At least they weren't 100% certain because it had already ruptured at that point.
Oh, wow.
So there was bits and pieces of things that happened over the span of years that kind of ticked off the or I guess like checked off the boxes for PCOS that I didn't know I had until maybe a couple years even in the future when I started trying to have a baby. That's when it really became apparent that I was having some issues. When I was on birth control, I didn't have a very regular cycle because I had the IUD. So I didn't have a cycle really at all. And then once I had removed that to try to have a baby, I realized that my cycle had no consistency whatsoever. The doctors at the time had said that you really need 2 of the wickets to be met in order to officially get that diagnosis, and they weren't seeing both of the wickets at the same time. They did see that I have blood work showing that my androgen levels were a little bit high and that I had periodic acne, but they didn't see any kinds of symptoms beyond that really, so they weren't comfortable labeling it as PCOS.
Mhm.
And then one of the providers that I had realized that I was struggling with fertility issues, and so she said, "You know what? Let's just try you on some metformin and see how you do. It's very possible that you have PCOS, so best case this works, worst case it doesn't." And then we tried it, and probably within 2-3 months I was pregnant. And so then probably 2 to 3 months into my pregnancy, they had done an ultrasound, which is obviously routine while being pregnant, and they had
Mhm.
seen that I had a large ovarian cyst, and that just kind of confirmed to them like, okay, you probably had PCOS this whole time, but
Right,
now we're
right.
seeing all of the stars align, and we can feel comfortable labeling it as such. And that's kind of my story of how I found out about PCOS.
So you talked about some of your symptoms. So you had acne and you said that they did blood work after you had abdominal pain. Was that about the time or was that later?
I think I'd gotten blood work done during routine physicals over and over again. And every now and then they would comment on the fact that my androgen levels were high and that my testosterone levels were high.
Okay.
They would
So
periodically
that
say my hormones were out of whack.
So again, like so typically what I see with a lot of patients is that these levels are not checked. So the fact that you had these levels checked and they were like specifically testosterone, that is a sign of PCOS when women have high testosterone.
Mhm.
It doesn't confirm a diagnosis. Again, as you know, it's very tricky, and they for some reason don't want to go down that path of PCOS, so that's interesting. How did that make you feel emotionally? Like when you were going through all of those things and having, the acne, um, the abdominal pain, like not knowing if it really was a cyst or not. How did that make you feel?
I just remember being a teenager, being so self-conscious about having that acne, being
Mhm,
told that it was, everything that I was eating, and then trying to be very, very conscious of the things that I was eating to be able to put a band-aid on the acne. And then as I got older, the weight became an issue, and it felt like I was having to work extra hard to just
mhm,
keep myself at a at a comfortable average weight, because anytime I would kind of slack off, it seemed like I would gain 5 to 10 pounds out of nowhere. And so that was really difficult. Another thing I would say was difficult was sometimes my hair would kind of fluctuate. It would go through periods where it would be thinner or thicker, like have hair like in some areas that I didn't really want it. And that was kind of embarrassing, not something that I wanted to be dealing with. But yeah, I would say that the most emotional it was for me was when a doctor had told me that the probability of me being able to have a baby was very low, until I got my cycle under control, because if they couldn't figure out, the timing where I'm ovulating, it's incredibly difficult to conceive a baby. And that was the toughest conversation that I probably had. Everything else was fairly small compared to that. But
So you were able to get pregnant. You had a child, you have a baby now. So after having the baby, is PCOS, has it been something that is an ongoing diagnosis for you? Meaning like your goal is to get pregnant, they put you on that medication. What was after having your child, like what was the follow-up for the PCOS? What is your treatment currently?
Well, so immediately after having my baby, one of the bigger struggles that I had was being able to breastfeed him. I know that early on, some of the lactation consultants that I had been seeing had said that PCOS is one of the main reasons for mothers to not be able to breastfeed their children. And so there was a lot of primary care doctors that I had seen that weren't very well educated on that fact. And so the lactation consultants kept kind of foot stomping the fact that, yes, this is something that we see often. So if there's anything that you could do to, get some supplements from the hospital, then maybe that could help the journey along. But that is something that I felt like a lot of my primary care providers didn't have any knowledge about at the time. So that was really difficult, just trying to be able to give my baby what he needed. And then throughout that process, also, a lot of the doctors kept encouraging me to eat like oatmeal and stuff like that, like foods that were really not really great for my condition, at least. Like now I know that foods like that tend to cause inflammation for
Yep.
myself.
Yep.
And so I had probably put on a decent bit of weight just from not moving enough, and then from eating the wrong types of foods. So being in a more sedentary lifestyle postpartum really wasn't good for my condition.
Right. Right. So they didn't continue treatment. You were breastfeeding and you were able to breastfeed, but your treatment for PCOS had stopped, correct?
Yes, they said that while I was attempting to breastfeed, not to take metformin, not
Right.
to take any kinds of supplements that would negatively impact breast
Right.
milk or my
Right.
baby.
That,
Yeah.
yeah. Okay. So now that you're not breastfeeding anymore, correct?
hmm
And so have you began treatment again now for PCOS? Do you think this is an ongoing thing that you will have to deal with forever? Do you think that this is an ongoing diagnosis for you?
From what I can gather, I think it might be. However, like there's ways that I've been able to manage it. I'd say that really keeping my diet in check makes the biggest difference for me.
And
I found that. Go ahead.
just out of curiosity, what does that mean? Like what is your diet? What does that mean? Diet in check.
So the diet that I found works best for me is lower carb, lower sugar altogether, less processed foods,
Okay.
um, drinking tons of water, basically no kinds of soda, alcohol, all of those types of things. Like
Okay.
I kind of cut those out a long time ago anyways, but just really making sure that I don't um, introduce those foods back into my life. I find that
Mhm.
every single time I do, I can almost feel when my body is, going through inflammation, I guess. Like it
Yep.
feels like I'm bloated. I
Loaded.
feel tired all the time.
Hmm.
My skin breaks out really bad. And it's just, to me, at this point, it's not really worth it.
Right, right. So, what advice would you give to others who are living with PCOS or suspect that they may have it? What would you suggest or what would you recommend as a person who's gone through this now for what, 7, 8 years?
Yeah.
You've kind
About
of been, yep, yep. So, what would you advise people who think, they're struggling with maybe hormonal issues that could possibly be PCOS?
I guess I would say that my advice is trust yourself, when your body doesn't feel right.
Mhm.
And if you suspect that something's wrong, make sure that you're going to the the right doctors that are willing to help you get to the root cause rather than putting band-aids on things and not understanding your condition. Um, I would say the things that helped me the most is to change my diet, change my exercise routine, and honestly, like at least for my skin, because I probably tried way too many things to fix the acne that I had at the time. Try to keep your skincare routine simple.
Mhm.
Your skin is very precious, and overdoing something like that isn't necessarily the fix either.
Right.
I would say speak to professionals on that one as far as what to do to manage acne, but for the weight and the other symptoms, I would say that making sure that you're just watching your diet and even just walking every day makes a world of a difference, I
Mhm.
find. But the right doctor will help you find the answers that you're looking for. And if you're finding that you have dismissive providers, maybe try to reattack with a different provider that's a bit more open minded about what could be wrong.
Mhm. Yep, yep, I agree with that. Do you think there's any misconceptions out there about PCOS? Like, in your time, do you think that there was anything misunderstood or, do you think people when you hear the word PCOS, do you think that people understand it?
Um, I think that I think that oftentimes when you have a patient that struggles with weight, um, doctors, at least from my own experience, will be a bit more concerned about how you live your life, of
Mhm.
course, and trying to figure out all of those things. But I found that I had more blame towards me for what I may not have been doing versus trying to
Right,
figure out if there was something else going on. Like I would have blood work that would say one thing,
right.
but they were hyper focusing on other things. And to me, I felt like um, maybe having some more discussions on the foods I should be eating rather than watching my calories as much
Mhm.
may have been
Correct.
more helpful for me
Mhm.
because they would say, like, make sure that you're in a 500, basically, like, make sure you're in a calorie deficit of 500, and
Yeah,
that will
yeah.
fix all your problems. Walk
Mhm.
more, that will fix all your problems. Whereas for me, I find that um, high intensity cardio or strength training types of exercises works more for me. There's certain types of exercises I would say are more effective for the condition than others. And then um, definitely managing sugar and carb intake, I would say, is more helpful than just blanket statement being in a 500 calorie deficit.
Okay. Um, did you do you have any resources or any support networks? Did you use anything else or did you strictly rely on um, doctors?
There's been some accounts, I guess, that I follow, like on YouTube, um, and some Instagram accounts that I follow. Um, Normally, if you just type in PCOS, you'll find 5, 6 different accounts that have really good tips on things that you could try. I mean, it tells you to drink like spearmint tea, like peppermint tea, stuff like that to kind of manage your androgen levels. Just like little kind of life hacks
Mhm.
for people who have this condition. It tells you different supplements to try, like berberine,
Okay.
magnesium,
Okay.
B complex vitamins, stuff like that, and inositol. Those have all been really, really helpful for myself. I don't personally love the idea of being on a pharmaceutical medication chronically for my entire life. So I was trying to find natural alternatives that could kind of do the same thing. And I think that those supplements have helped a lot.
Okay.
Less side effects too.
Good. Good. So I want to conclude. I want to thank you so much for listening in. Thank you so much, Emma, for your time and your insight on this condition that I, as a provider myself, I know a lot of people aren't aware of, and I'm sure my whole goal in offering these this podcast and these YouTube videos is that somebody somewhere learns one thing, has one takeaway. So hopefully we helped, and you primarily because you shared your story. Hopefully we helped somebody out there. If you have any questions or comments, please leave them in the below of this video, whether it's podcast or on YouTube or social media. If you want to see more of videos like this, please subscribe to my channel. And again, Emma, thank you so much. I appreciate all of your insight, and hopefully this journey, hopefully you have it figured out to where you can hopefully be happy and not have any issues. So again, thank you so much. And I look forward to hearing from you all. Thanks.
Thank you for having me.
Thank you for tuning in to this episode of the Bird Island Wellness Podcast. I hope you found our discussion insightful and inspiring. If you've enjoyed today's episode, be sure to subscribe to Bird Island Wellness wherever you listen to podcasts. And don't forget to leave us a review. Your feedback helps me improve and reach more listeners. If you have any questions, topic suggestions, or stories you'd like to share, I'd love to hear from you. You can reach out to me through my website or connect with me on social media. Until next time, remember to prioritize your health, nurture your well-being, and spread positivity wherever you go. Take care, and I'll see you soon on the next episode of Bird Island Wellness Podcast.